Have you been struggling to lose weight and wonder if there might be a medical reason why this is? This video is for you. Hey Carb Dodgers, my name is Dr. Dan Maggs. I help people who've been struggling to lose weight achieve their goals of long-term sustainable weight loss. I struggled with my weight right up until I was in my early 30s when I was officially obese, and I lost it all and have kept it off ever since. Now I make videos to help people like you do the same. I release new videos every Tuesday, so be sure to hit the like button and press that bell to get notified whenever I release a new video. So it's not uncommon for people to think that there may be an underlying medical reason as to why they are gaining weight or are having difficulty losing it. In this video, I'm going to take you through some of the common and some of the not so common medical reasons why people struggle to lose weight. Now, I find it really helps to think of these problems with some of the different hormonal systems that affect our bodies. So rather than just listing a load of medical problems, I'm going to break this down by the different hormonal systems and discuss some of the medical problems that fall into each. Let's get started with one of the most common, thyroid hormone problems. The thyroid hormones are an important regulator of our metabolism. I like to think of them as acting like the accelerator or gas pedal in the car, controlling the speed of many of the body's functions. If the thyroid is overactive, everything speeds up. If it's underactive, everything slows down. So hypothyroidism is the medical name for an underactive thyroid, and this is probably the best known medical cause of issues with weight loss. Now, approximately 5% of people have a problem with their thyroid gland, and it's estimated that 60% of those 5% go undiagnosed and untreated. Some of the symptoms of underactive thyroid glands are slow heart rate, constipation, dry skin, low mood, hair loss, cold intolerance, and of course, weight gain. Tests for thyroid disorders are among the first tests that I order for my patients who are struggling to lose weight or who are experiencing unexpected weight gain. Hypothyroidism is really common, easy to test for, easy to treat, and frequently undiagnosed. In fact, my mum went underdiagnosed for years and she was mistakenly diagnosed with depression, which magically got better when her underactive thyroid gland was treated. So if you're experiencing some of the symptoms I mentioned earlier, then it's probably worth having a chat with your doctor. It's a really silly one to miss. So the second group of hormones that I want to talk about today are the stress hormones, in particular cortisol. Now, cortisol is one of the main hormones that helps our bodies respond to stressful situations. It has some very useful short-term effects, such as increasing our blood sugar levels, increasing our attention, decreasing our sensitivity to pain, and increasing our blood pressure. So if you're being chased by a lion, these are all pretty useful things to have happen to your body. But the problem with cortisol is when these effects become prolonged, such as when somebody is always stressed out. So the next main medical problem that I want to discuss that may be preventing weight loss, if that's what you're trying to achieve, is chronic stress. Now, chronic ongoing stress is very bad for our health. Persistently raised cortisol causes persistently raised blood glucose levels, think diabetes, or persistently raised blood pressure, think heart disease and strokes. And it also decreases the immune system. People who are chronically stressed frequently get more infections. And it also causes decreased levels of serotonin, which is the happy chemical, think depression. And the excess glucose levels caused by constantly raised cortisol will also cause cravings for sugary, high-carb foods. In fact, there's also a disease that causes excessive cortisol secretion, which gives us kind of an extreme version of what happens when we are chronically stressed. Now, Cushing's disease is a rare tumor that causes a significant amount of cortisol to be produced. And so people with Cushing's disease typically gain weight, mainly around the abdomen. They also develop fat on the upper back. They develop a red, round, puffy face. They get purple stretch marks across their abdomen. They also experience mood issues. And I always think that Cushing's disease is like an extreme version of what happens when we're chronically stressed. So other conditions that go hand in hand with chronic stress are, of course, anxiety and depression. and persistently raised cortisol is something that people with anxiety and depression can also experience. So it's not hard to see why people who are suffering from those issues often also gain weight. Of course, some of the medications we use to treat anxiety and depression can also cause weight gain. And I'm also going to talk about some of the medications that can cause weight gain later on. The third different hormone that causes problems with weight gain is called leptin. Now, leptin is a hormone that is produced by our fat cells, and high levels of it tell our brain that we don't need to eat. So it reduces our appetite. So the more fat we have, the more leptin is produced, which should tell the brain that we're not hungry. So what causes problems with leptin? Well, sleep problems. Whether you've got a medical problem that is causing issues with your sleep, which are probably too numerous to mention here, or you're just someone who doesn't let yourself get enough sleep. Sleep is an important regulator of our metabolism and therefore our weight. And sleep issues can cause problems with your weight. Very simply, when sleep goes down, weight goes up. There was quite a famous study done a few years ago in Finland. A group of women who had 6 or less hours sleep a night actually gained 5 kilograms, which is about 11 pounds over a 7-year period compared to those who slept longer. There are a couple of ways in which it goes about doing this. Sleep deprivation leads to reduced levels of leptin, so you're simply more hungry after a bad night's sleep. And to top that off, a tired brain just doesn't make such well-reasoned judgments about nutrition. In fact, you're far more likely to be impulsive and give in to the desire for junk food after a bad night's sleep. And now I want to talk to you about something called leptin resistance. As I mentioned before, leptin is produced by the fat cells to send a signal to your brain. So why do obese people get hungry at all? Think about it. If you're obese, you have a lot more fat cells that should be producing a lot more leptin than someone who's slim. This in turn should suppress your appetite so that your weight normalizes again. But it's pretty clear that there's something going wrong. So in the same way that an alcoholic becomes resistant to the effects of alcohol and needs more alcohol to become intoxicated, our brains can also become resistant to the effects of leptin. And this is known as leptin resistance. And leptin resistance is one of the key hormonal problems that will prevent your progress towards losing weight. And it's probably not a condition that you will find regularly diagnosed, for example, by your doctor, but it is one of the key hormonal disorders that exists in our body that causes problems with our weight. And the fourth hormonal system that I want to talk about today is problems with insulin. Now, I talked about how understanding the role of insulin in the body is key to understanding weight losses in this video linked up here. Insulin has many roles in the body, but one of its key roles is the regulation of blood glucose. If our pancreas senses that blood glucose levels are elevated, such as after a meal that was high in carbohydrates, then it will release insulin into the bloodstream. Now, insulin allows blood glucose to be taken up by the cells, mainly fat cells and muscle cells. But much like with leptin resistance, where the brain stops listening to the signals from the leptin, insulin resistance also occurs. And in someone with insulin resistance, more insulin is needed to shift the same amount of glucose into the same cells. And the result of this is that raised insulin levels exist long after someone has finished a meal, much longer than they should be. And if you've never heard of insulin resistance before, you'll pretty much almost certainly have known some of the conditions that insulin resistance is a key abnormality in, such as obesity, prediabetes, type 2 diabetes, and polycystic ovary syndrome. So just remember that insulin is the hormone that tells the body to store fat. So if insulin levels are raised above where they normally should be, particularly over a sustained period of time, then you're going to have issues with weight. It's very easy to gain weight in that situation, but it's very hard to lose weight. Finally, I just want to talk about a few other medical things that don't neatly really fit into the different hormonal symptoms, but are important. Weight gain is the side effect of many different types of medications, and this is often down to the actions that those medications also have on the hormonal systems that we described earlier on. For example, insulin, or any drug that tells the pancreas to produce more insulin, will cause weight gain. And steroid medications are really well known to also cause weight gain. But what steroid medications are essentially synthetic versions of cortisol. And we're using them because they suppress the immune system, just like I mentioned earlier. But they have all the other same side effects of chronic stress too. And many antidepressant tablets also cause weight loss. Now, there's loads of different reasons why, and that's probably beyond the scope of this video, to be honest. Finally, there is one other condition that many doctors, to be honest, haven't heard of. Lipoedema is a long-term chronic condition where there is an abnormal buildup of fat cells in the legs, thighs, and buttocks, and also occasionally in the just in the arms here. It almost exclusively affects women, and people with this condition really struggle to lose weight from those areas. And in fact, many lose weight off the upper body quite well. And so if you have a significantly abnormal distribution of fat from upper body to lower body, and you find it particularly difficult to lose weight from those areas that I described, then this is something you may wish to look into further. But as I mentioned, it's not something that doctors commonly know about, so you may need to take some more information into your doctors with you if you're going to go in about that condition. So in general, most of the conditions that cause problems with weight loss have a hormonal basis, particularly the thyroid hormones, problems with cortisol, problems with leptin that affect your appetite, and problems with insulin. So now at the beginning of this video, I mentioned that problems with the thyroid were very, very common, and you may have well have known that thyroid problems caused issues with weight before watching this video. But I actually think that problems with leptin resistance and insulin resistance are way under-recognized as hormonal problems that prevent people from losing weight effectively. And many overweight or obese or pre-diabetic or type 2 diabetics are strongly insulin resistant and probably leptin resistant too. And that way outnumbers the number of people with hypothyroidism. And the problem is that these conditions aren't effectively addressed by low calorie diets, but they are addressed by low carbohydrate dieting, intermittent fasting, and all the other lifestyle things that I talk about on this channel. So thanks for watching, everyone. I hope that's been useful. If you've enjoyed this video, then please give me a like down below. Share it with your friends who might benefit from this information. Leave me a comment and don't forget to subscribe to the channel, and I'll see you next Tuesday.